Hello, my name is Dennis Zayas. This is my wife.
I'm Jessica Zayas.
I am a ECMO patient that was on it for 89 days, 60 of them incubated without knowing what I was doing. I woke up with it and I knew that I was in some kind of trouble. I just didn't know what it was. Found out that my lungs were shot and it was the only way to survive. I don't know if it was what I had gone through, but I knew it was my only source of survival, so I just went with it. There was no fight back. There was no, I don't like this machine. I knew that it was my source of survival, and I went along with what I needed to do to survive. So the biggest thing I take away from it was to be educational with your patients. Some of them might not seem like they want to know, but the more that we train, not just doctors, nurses, is to train our patients on the use of these machines will just help spread the word of how useful and how life-saving this machine can be to everybody.
So being the patient advocate that for your loved one, Dennis went into the hospital in July of 2020 with COVID, and 2 weeks later, he was placed on ECMO. They tried everything they could. And when they first started talking to me about ECMO, I knew a little bit about it because a friend of ours' grandson was on it, but he was only on it for a few days. So I had to learn about it, and I was that person asking questions all the time. At the beginning, I wasn't able to see Dennis for the first 2 months that he was in a hospital, and then they started lifting the restrictions that one family member can see the patient. And when I went to see Dennis, he was already on the ECMO machine, and he had a nurse in his room at all times. And that is the person that you count on the most, because you know that ECMO specialist, that ECMO nurse is going to be with your loved one for 12 hours a day. And you grow a relationship with them. And, I was the one that I was always asking questions. So what does this machine do? What's the suite? And what is, his oxygen level and his vent? Why is his vent at this much? And so it's, I know at times it can be annoying or stressful because you have your work to do. But the nurses took their time and explained things to me. I work for doctors, and I remember talking to one of the doctors that I work with, and I was giving him all these numbers, and he was like so amazed. He was like, "Oh my God, Jessica, you're like talking nursing here." And I started laughing. I'm like, "That's because I have the best teachers. They're teaching me this stuff." So, and I knew that this machine was saving Dennis' life. And I knew that this machine, I didn't know much about it, but when I did learn about it, it's an amazing machine. And, like you were talking about the oxygenator, and they put the flashlight, make sure there's no clots in it. And, I'm asking questions, why do you do that? And they're, put the flashlight on there, and they're like, "Oh, because we want to make sure that there's no clots in it." And I'm like, "Can it create clots?" And they're like, "Yeah, it's circulating." So it's just amazing. And when they changed the cannulas, why are you changing the cannula? And, seeing that his flow will get better after they change the cannula. So those little things, when you explain to the families, it makes a huge difference to us. And I know that, like I said, you guys have busy days, sometimes don't even get to eat, take 30-minute break, you take a 15-minute break because, you have to go run back to your patient. I just want to say thank you from the bottom of our heart. No matter which nurse, I know you're taking care of an ECMO patient. Thank you so much for being so, giving your all to your job, because I know it's not an easy job. And it can be hard times, but just know that I really do appreciate all the ECMO nurses in this world. I know Dennis does too. He used to communicate with them with this little noise that drove the nurses crazy, but we do appreciate everything you guys do.
Yes, we do.